health alert out of Arundel County as the county sees an increase in drug overdoses in the last few days. The Department of Health reporting 16 suspected overdoses just from the past weekend. One of those was fatal. Joining me now to discuss this is Arundel's health officer, Nilesh Raman. Thank you so much for being here tonight.
Thank you.
Nilesh, let's kind of get into this because obviously not the kind of alert that we want to get. What are these overdoses over and why are you seeing a spike right now?
Yeah, what we believe we're seeing is overdoses due to cocaine or crack that's being contaminated with fentanyl. And so what we're seeing is that people who don't think they're getting fentanyl or other opioids are accidentally getting that and are overdosing accidentally from that. And that's in line with what we see, which is multiple substances in a person's bloodstream when they're overdosing.
And is this something that's different from what we're seeing year to year? Are you seeing a spike right now because we're getting closer to the holidays, or what would kind of explain the recent spike right now?
Yeah, it's a little hard to figure it out as it's happening, why it's happening, and that's where we do more investigation. But we wanted to put the alert out at this early stage just to let people know that it's happening so that they can take precautions.
And what are some of those precautions that people can be taking right now, or at least maybe to educate and inform their loved ones?
Yeah, so one of the things that we want people to do is know that if you see somebody who's overdosed or unconscious, you should call 911. If you have naloxone, give it to that person. Even if you don't think that it is an overdose, if they're unconscious, do that. If there's no response, you can give them a second dose of naloxone and make sure you don't leave that person alone. And it's important to know that because of Good Samaritan laws, you will be held harmless if anything happens to that person who's overdosing. Just give them the help that they need.
Yeah, because sometimes, emergency personnel might not be able to get there in time. So some people might have to act within seconds, within minutes. What can people do to maybe get some information out to folks? Are you trying to do some outreach right now?
Yeah, so one of the things that we do is we do have peers, so staff at the health department who go out to every single person who's overdosed to talk to them, to try to engage them into treatment, but also to provide harm reduction services. We want to make sure that people are on the pathway to recovery and that we're providing them all the tools they need to stay safe. So Narcan is one of those things, but also fentanyl test strips. People are using, as I mentioned, drugs, and they don't expect to have fentanyl in them. And so these test strips can help them tell if it's there or not.
And that's prior to them taking it?
That is correct. That's prior to them taking it. And it's part of a way for people to be able to make sure that they know what they're putting in their body. Obviously, we don't want people to do drugs, but that's happening every day. And we want to keep people alive long enough so that we can get them into treatment.
Yeah, those test strips can be life-saving in so many of these circumstances because, unfortunately, we have seen so many fatalities with people not knowing that whatever drugs they thought that were taken were laced with fentanyl, which is so deadly.
Exactly, and for people who are not taking opioids, their body is very much susceptible to an overdose because they're not used to that high level of the potency of that opioid.
Nilesh, do you see this is also going to be worse during the holiday season? Is that a trend that you guys follow?
You know, we typically see that during the holiday season we see more depression, and it's a bit variable as to whether we see more overdoses or not. So we're always keeping our eye really focused on the data, and we want to be able to catch these kinds of changes really quickly. So we just want to make sure we got the word out right now.
Yeah, it's an important message. Hopefully those numbers go down, but I think everyone just kind of has to be on the lookout and watch out for each other because it can be very, very scary. Again, Nilesh Raman, thank you so much for your expertise tonight.
Thank you for having me on.